Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
Oregon researchers spent the past 2 years poring over millions of medical records from veterans nationwide.
Now, they found a connection between hearing loss and Parkinson's disease and say a hearing aid could reduce your risk of developing the disease in the future. Ashley Grams has the details.
Yeah, I can hear you just fine, thank you.
Sitting down for a hearing test
Just raise your hand whenever you hear the beeps.
can tell you a lot about your overall health.
And a hearing test is incredibly easy. It doesn't take long at all.
Epidemiologist and audiologist Kelly Rivas controls the sound levels.
So this test is just a pure tone hearing test. It's basic audiometry is what we used in the analysis.
It's data from hearing tests like these that helped researchers with the VA and OHSU find a connection between hearing loss and Parkinson's disease.
This really was a patient-driven sort of question.
Lee Nielsen is the lead author on the 2-year study that analyzed medical records spanning 2 decades from millions of U.S. veterans.
It was a really exciting finding.
The study found that veterans with hearing loss are more likely to develop Parkinson's disease.
I have a lot of confidence in the association that we uncovered with this particular data set.
But Nielsen and his team didn't stop there. They wanted to know if wearing a hearing aid would impact that development of Parkinson's.
How does a hearing aid affect this? And it brings the risk back down big time, which is a shock and also very exciting.
Dr. Gregory Scott, a pathologist, believes further research into risk factors like hearing loss could help doctors identify the disease earlier.
Let's catch it early and try to prevent it from getting worse in your 40s or 50s.
Right now, there's no cure for Parkinson's.
We're just trying to find the softest sound that you can hear.
But Scott and his colleagues believe hearing aids could at least reduce that risk.
This could hopefully inspire some folks to consider it.
Getting evaluated for a hearing aid is going to be something actionable for a disease where there's otherwise no action.
Ashley Grams reporting there, and for more Healthier Together stories, just go to our website, kgw.com/healthiertogether.